been said many times, there is no health without mental health.
Mental health care in California has always been a fraction system. We've always been able to treat the physical needs of the patients ahead of the mental health needs. So overall, we have an imbalance between supply and demand, and our patients are falling through the cracks.
The challenges are enormous. What we're seeing is dramatic increases in anxiety and depression.
With the current situation the way it is, with the huge shortage of providers in psychiatry, we're putting patients at risk, increased risk of suicide, increased risk of depression, anxiety, especially among the children and adolescent ages. And there's just not enough providers.
One of the solutions is having more psychiatric nurse practitioners out in the community. Psychiatric nurse practitioners do a lot of the same things that a psychiatrist or a primary care physician might do.
It's definitely a critical time. We really need to have these providers. We need to give patients hope.
A psychiatric mental health nurse practitioner is a licensed individual who can assess, diagnose, treat, and manage simple and complex psychiatric disorders ranging from the whole span of psychiatry, including substance abuse.
People think, well, this is a new thing. Actually, it goes back to 1955 when Rutgers University applied for a grant from the National Institute of Mental Health to develop mental health training programs for nurses to become specialists in this area.
In a psychiatric team, you're going to have a psychologist, you're going to have the therapist, you're going to have the psychiatrist, and then you're going to have the psychiatric nurse practitioner. So we function very similar to a psychiatrist, really. We do medication management, we can also do therapy, we can work in an acute care facility, we can also work in family practice and specialize in psychiatry. So the field's very broad.
You know, I've had the good fortune of teaching at a couple of psych nurse practitioner programs, and what a nurse brings to this field is nothing short of extraordinary. They're trained in the empathic care of their patients. And I think the nursing training that every nurse gets really makes them very, very well suited to be excellent behavioral health care providers.
As far as providing care as a nurse, we're limited with our scope of practice. As a nurse practitioner, we can act as a provider. So not only are we assessing our patients, but we're also able to diagnose and then write a furnishing order for medications. So we take a larger role as their provider rather than just as their caregiver as a nurse.
You know, a lot of healthcare now is moving towards coordinated care. And so we often have a gatekeeper or primary care physician. And it's so important because sometimes patients don't know exactly what they need. And having that individual that understands the patient's needs and is able to coordinate the care so that the patient's care is efficient and they get to the better health that they will want to get to.
When we're talking about coordination of care for people with complex health issues, mental health being one of them, you really want a person that has certain competencies. You want someone that has a certain level of education. A nurse practitioner is really the expert to be a care coordinator.
It's really a mutual relationship with your patient, so you're co-managing the condition, and this is by far the most rewarding field because you really do make a difference in these people's lives. So you really change, you can change everything really, and in the end, you know, hopefully save their lives.
I think the need is so great that people can say, I can really make a big difference here.
What we're looking at is hopefully increasing the number of psychiatric nurse practitioners we have in the state of California to meet the demands. We have just so many people that are in need. It's an underserved population.
The psych NPs make actually very good money, starting at about $130,000 to $170,000 a year. The demand is all over.
So nurse practitioners will be able to choose, do they want to get into the training side? Do they want to get into being part of a bigger team, a novel team approach? Do they want to be frontline providers themselves? So I think that the options available are extraordinary.
So at WesternU, we're going to offer 2 psychiatric nurse practitioner tracks. One will be a post-certification, the other one will be a master's in psychiatric nurse practitioner. So it's an online program. We offer flexibility to the student that is going to work, has family.
There are a lot of nurses who cannot attend a traditional program, and Western University of Health Sciences offers a program where they can learn at their own pace, at their own speed. The faculty at the College of Graduate Nursing know all their students and support them one-on-one and in groups, both online and face-to-face as the students need as the program progresses.
We've got leading faculty who are teaching and directing the program now, and we are using a state-of-the-art curriculum complemented by online learning, experiential clinical activities, and simulated case studies.
What we're doing now is we're going to institute some virtual reality and augmented reality so they have a better comprehension of the patient lived experience.
What has made WesternU a very special place is the fact that we are solely focused on graduate health education, training the next generation of health care providers, and we've had an opportunity to use that to our advantage to have the students work together in what we call interprofessional education.
A student who is attending this type of program will have the opportunity to not just speak to practitioners that provide different aspects of care, but to be able to collaborate and discuss patient needs.
Having all of these disciplines on one campus, collaborating, it's phenomenal.
You'd want to pick Western University because we have a very high completion rate of all of our programs. We have excellent outcomes on national certification exam, State Board of Nursing exams.
We are committed to their success. As I tell my students, we are here to support you forward to success. And so we work very closely with our students.
They recognize that we're professionals and that we have other obligations other than school, and so they're willing to work with you to make sure that you're successful in meeting your goals.
I would love to be a psych nurse practitioner. It's something that I've always wanted to do. I've been waiting for a program to be available in my area.
This program advances the university's mission, where we learn to heal together, to train together, and to care for the vulnerable population together.
I would recommend Western University's Psychiatric Nurse Practitioner program because not just the need is so great for psychiatric nurse practitioners, but also because of the culture at Western University. It's a very caring culture, it's a very holistic culture.
This is a decision that hopefully when they really look at it and they're honest with themselves is something that they should very strongly consider. Getting an outstanding education, but offering outstanding opportunities for diversity and to make a very, very positive contribution to overall care.